Oh, on camera it still looks good because the camera's aiming down. I like sitting in this spot. Did you prepare any questions?
Of course.
Figured.
About 30 questions. There's no need for these. Just check you out. Welcome to live show 135, Hormone Replacement Therapy. We talk HTR. Hello everyone, and a massive welcome to our viewers tuning in from across the globe. We're coming to you live from the Other Side studio in Minsk, Belarus on this beautiful evening, May 25, 2025 at 8:30 p.m. Minsk time. That's 6:30 p.m. London, 1:30 New York, and 4 a.m. in Sydney for the early birds down under. First of all, I'd like to apologise to our guest Andrew, our resident medical expert, as we've been trying to do this show for a few weeks now, but things got in the way each time. And in fact, we had it scheduled for this coming Wednesday, but pushed it up to tonight. I'd like to welcome Andrew to the show. Thanks for coming, and all of Andrew's links are in the description below where you can find him.
Hi, and thanks for having me on.
Okay. And before we start, can you tell everybody even though all the links are in the description below?
Yeah, I'll give a little intro for myself. My name's Andrew Hutchings. I'm a master of sport in the Russian Federation. I'm also a professional bodybuilder, got a degree in biochemistry and molecular biology. And because you cannot test out of medical school, I am technically a medical student. I have to take each exam only at the standard time that they're offered to all students. So got to wait a little bit before I can say I'm a licensed medical doctor.
Should we call you a medical expert or an advisor?
Yeah, I call myself a medical expert because I try not to get in trouble by calling myself a doctor.
Yeah, no, I was just wondering if it was expert or advisor.
I'm not big on words, whatever works.
Except a doctor, as yet.
Yeah.
So tonight we're delving into the world of hormone replacement therapy, HRT, with our incredible resident medical expert, Andrew, who we just said, who's here to answer all your questions about this game-changing treatment, from benefits to risks and everything in between. We've got an informative engagement show lined up. You're watching us on Rumble, not on YouTube tonight because it didn't work, and X. So make sure you drop your questions in the live chat, share the video link with friends, hit that thumbs up, and subscribe to our channels and stay in the loop. Andrew's links are in the description below, so check them out for more health insights, and subscribe to his channels, and he puts up videos.
I'll be putting up some more videos soon. I took a little break because I did 2 bodybuilding competitions recently, and then I had a heavy medical school workload. Infectious disease hospital right before the bodybuilding competitions. Not a good combo. Reduced immune function while around a bunch of infectious diseases. Caught a couple of them. Luckily, they're not the kind that stick around long term. But yeah,
As
more
he
content
moves
will be
away.
up soon.
As he moves away from you. Okay, let's start with the questions. Can you explain what hormone replacement therapy is in simple terms for our audience?
So, hormone replacement therapy, it's largely misunderstood because of a lot of reasons. First of all, my specialty is with men. I can tell you about for women, and it's equally as important for women, perhaps even more so. So I guess let's first talk about men and women, because they're very different. People know a lot about, for men, testosterone replacement therapy, human growth hormone. Men, your production of hormones gradually reduces as you get older, and it is very important to keep those levels up. But women, it just drops off during menopause. So whereas a 60-year-old man might still have 20% of his hormone production that he had when he was 20 years old, a 60-year-old woman has more like 2%. So in that regard, it's actually more important for a woman to do hormone replacement therapy. Now, what I want to add in is that hormone replacement therapy is not the way to go. Hormone optimization therapy is. What if your hormones weren't ideal when you were younger? You want to just try to copy what they were? Plus, do you know what your hormones were when you were younger? Did you test your hormones when you're 20 years old?
No, but I do know them now, and I've got, I've been checking them now for 5 years, so at least 5 years ago.
Great, but you cannot do hormone replacement therapy because you don't know what you would be replacing.
No,
to.
it'll be a guess.
Yep.
That's why you suggest women should test their hormone levels early.
if you're like my woman should definitely
In their
test
20s.
4 times a month.
Yeah.
Once a week for a month, because they have changes of hormones according to their menstrual cycle.
Mm-hmm. And what age group do you think
Eh,
is the best?
Test it before you give birth. So when you're, it depends on when you give birth. But
If you give birth.
if you
these
give
days-
birth,
these
yeah,
days.
it's pretty rare now.
Yeah.
But if you haven't given birth at 20, test it at 20.
Okay.
If you're 18 and you want to give birth next year, test it when you're 18. For men also, you want to try to get it around 18 to 20 years old. There's a misconception that I heard some endocrinologists tell me recently that men's hormone levels keep increasing until they're 30 years old. It's like, no, they don't. Maybe in some perfect vacuum that doesn't exist, but real men in the real world, you're typically going to peak in your late teenage years, maybe early 20s.
I've noticed mine dropping slightly each time I get a blood test.
Interesting.
Well, I mean, not
Just a tiny little bit.
Yeah, like fraction, like a 0.0, whatever.
And the other thing, the reason I say you want to do hormone optimization therapy, I said you don't know what your levels were when you're younger, and an average doctor might go, well, you don't know what they are, but we know the average normal range. Well, you walk down the street and you look around, like say you're a man, you walk down the street in California and you look around, do you really want to be put in the average range of what all those men around you are at? Because that's where the doctor wants you. They go, well, that's the norm, that's healthy. It's like, no, it isn't. The average person isn't healthy. You don't want to be like the average person. You want to optimize your hormones. So hormone optimization therapy is tailored to fit you to make everything function as good as possible while also avoiding your personal risk factors. Like with you, I know your medical things, and for you, there's certain reasons why it's not ideal. You've got to weigh the benefits with the risks. And if you're doing pretty good and then there's a reasonable risk, don't do it.
Exactly. What are the most common reasons people start HRT?
Nowadays, I would say it's men, oftentimes even boys. I don't call a guy a man just because he turns 18 years old. There's plenty of guys that are 25, 30 that aren't men. Maybe they'll never be men. But it's very popular now to go on HRT or TRT. Why exactly? Not social media, but what they think they're going to get out of it, I'm not really sure. It's really not common for people who need HRT to go on HRT. And HRT is not needed by most people in general. Hormone optimization therapy is. Like even you or someone like my father or just an average man who's older, he's not going to benefit much from going on medical hormone replacement therapy because the levels aren't going to be high enough. They'll bring you to the bottom or the middle of the normal range. It's not going to make much of a difference. Recently, I saw a man 2 meters tall, 120 kilos. Doctors brought him up to the bottom of the normal range. Just insane, the dosage they were giving him. a lot of guys they were giving him 250 milligrams of testosterone esters once a month. A lot of men are going to need that once a week just for proper sexual function.
What about these young guys now in their 20s where, excuse me, that they've been testing them and they found out their testosterone levels around the 60, 70-year-old men?
So that is true. The problem is what is considered the normal healthy range still encompasses that level. So despite them actually having low testosterone, it's considered normal and healthy because it's in the normal range. The normal range, by the way, in the American system, it's from about 300 nanograms per deciliter, sometimes as low as 250 nanograms per deciliter, up to about 1,200 nanograms per deciliter. That's a really big range. So if you're at 300, you're good according to the doctor. If you're at 1199, you're good, and that's how they see it.
Okay. What benefits can viewers expect from HRT?
I know we wrote this episode about HRT, but as I explained, from HRT, most people aren't going to see many benefits. Now, someone who has a true medical need, like they lose their testicles, that person would benefit from HRT. But 90-something% of people would benefit from hormone optimization therapy. What benefits you'd see? Increased energy, your body's going to feel better, your joints are going to feel better, your brain's going to work better, a lot of guys say they sleep better. I haven't noticed this effect with people as much as I've heard about, but basically everything's going to work better. Now, unless you do it wrong, and then everything's going to work worse. But if you do it properly, just everything works better.
Which brings us on to the next question. Are there any major risks or side effects?
So yeah, there's a lot, and that's why you need to work with an expert. Not just to market myself, but I am an expert. I have about 11 years of experience working with this stuff extensively with men and
his links are in the description box below.
Not so much with women. But if you do it wrong, it's a little bit different than hormone optimization therapy. It's a little higher dosages, but like the dosages that young men take for athletic enhancement, they're on the brink of a heart attack or a stroke oftentimes. And you try to convince them, hey, you need to stop this, or you need to change, or you need to take this other medication in order to save your life. And they'll be, oh no, I feel great. It's yeah, you feel great, but you're not great. There's a reason that bodybuilders drop dead when they're 30 oftentimes. Now, obviously, that's very different from a normal person doing hormone optimization therapy. But you need to look at you have to really in-depth analyze your health. You got to do extensive blood work. I have a very extensive blood work list I offer. It looks at everything, and you got to figure out, is it safe to begin or not? For example, if you already have high blood pressure, and hormone optimization therapy will often raise your blood pressure a bit, not like a crazy amount, but if you already got high blood pressure, you don't want to raise it a bit more. So first you need to get your blood pressure under control, then you can do it.
How do you customize HRT for each patient's needs or hormone optimization?
You start by analyzing everything about them, and you come up with a general idea of what probably will work well. But the human body, it's so heterogeneous. When you do medical studies on mice, there's medical studies on humans, of course, but a lot of studies on mice are looked at. Those mice are genetically identical. They've been inbred so many times that they are essentially clones of each other. And a little different topic, but if you ever read about these studies about, this chemical causes cancer, that chemical causes cancer, well, because they're testing it on these mice that get cancer from everything. You're that inbred, you're going to get cancer no matter what. But yeah, humans are so different that you start with that good idea based on what you know, but you're going to have to tweak it. And you got to know what you're doing, or else it's going to be bad. And you also have to know what you want out of it. For example, say you have a genetic predisposition to hair loss. Your hormone optimization therapy is going to be different from someone who has zero genetic predisposition who's not losing any of their hair. Because you can tweak things a bit so you don't lose your hair as much. But everything has its pluses and minuses, so if you don't have that predisposition, you wouldn't want to try to prevent it if you don't need to prevent it, because there can be possible side effects.
What types of hormones are used in HRT treatments and hormone optimization?
Typically only testosterone and human growth hormone for men. For women, different estrogens, progestins, It's very important that so men are my specialty. I still know about women, but I don't have a lot of experience with the enactment of their protocols. But for women, it's very important to keep the progesterone levels up, because if you use only estrogens, you'll get an overgrowth of the uterine tissues and some other tissues, and it's going to increase your risk of cancer, of other complications. Naturally, a woman has a menstrual cycle where estrogen levels and progesterone levels both change throughout the cycle. It keeps tissues growing and shrinking, and if they're out of balance, the tissues don't do well. So I would not recommend a woman to go on only estrogen. To go back to the benefits, I almost forgot about the really important benefits for women, considering that their levels drop off so abruptly and so severely. Like I said, a woman after menopause, during menopause, they have essentially zero estrogen production, zero progesterone. And that estrogen is what keeps your bone density.
Mm-hmm. That's why they get osteoporosis.
Yeah, and then they want to give you all these ridiculous medications instead of fixing the problem. The problem is that you don't have estrogen. Why are you giving these wacky drugs that don't work very well when you can give the natural hormone that keeps it completely good?
Now, we all know it's to make money.
And then also, when you don't have the estrogen, you get heart disease. You look at studies, women all get they don't all get heart disease, but they all start to get heart disease after menopause. Before menopause, women don't get heart disease, almost never.
Can you describe the different ways HRT is administered, like pills or patches?
So let's start with pills, since you said that first. There's essentially no pills. If you're a woman...
Why is there no pills? Because of the digestion?
Testosterone is not orally bioavailable. Now, there is a very long ester of it, testosterone undecanoate, which is, it's sort of orally bioavailable. It's not ideal. Can you get your levels up? If you're just looking to, do true like hormone replacement therapy, yeah, you could do it. You could probably even get them higher. It's not ideal. You would have to take the pills multiple times a day. Everybody's different. Maybe you can get your levels high enough, maybe you can't. But typically the way to go is with injections, because the testosterone, it can absorb. If you take most forms of testosterone orally, they don't work at all. The injections, they have different esters on them, which results in a different time release. Now, it does more than that. Maybe I'll get into that a little later. It's a big misconception that like testosterone propionate is the same as testosterone enanthate, simply a different time release. I'll get into it right now, actually, because it's an interesting topic.
Go for it.
Anyone watching this that knows what I'm talking about with the different esters of testosterone, you know what I mean, that it's touted as being the same drug. Now, the second you put an ester on a molecule, on a drug, it's a new drug. You have a receptor. The drug fits into the receptor. You put an ester on the drug sticking off of it, it doesn't fit in the receptor the same way. It interacts differently. This is common knowledge in pharmaceuticals, so I don't know how on earth it's gone this long with people acting as if the ester doesn't matter on the testosterone. That's not to say that the ester is not quickly metabolized off and it then turns into plain old testosterone. But for a certain amount of time, that ester is attached and it does have different pharmacological properties. And especially when you consider that when you inject testosterone, there is a bolus injection sitting in your muscle or in your fat that is slowly being released. So you get a little bit released every moment, and that little bit is the esterified form. It's a different drug. Now, slowly that ester is taken off, quickly the ester is taken off, but then a little bit more is released that has that ester on it. Now, I know I'm probably going a little too deep into pharmacology for most people, so I'll get back to the original question. The injections are the way to go. You can do an injection once a day, you can do an injection every other day, you can do an injection once a week. It all depends on what ester is attached to it.
And patches?
They do have patches. Patches are not ideal. It's just variable absorption, and to get the levels up high enough is tricky. There might be some really good patches. The cream is risky. That's not the same as patches. Patch, less risky. But if you got a wife and you put that cream on and you lay with her in bed, she's going to absorb that testosterone from you. So unless you want your wife to grow facial hair, get a deeper voice, have her breasts shrink.
Big dick.
Yeah, clitoris enlargement. You don't want to be using testosterone cream.
Okay. Can you describe, which HRT method do you find patients prefer most?
Injections.
And why?
Because it works.
It works.
Anybody who has experience with this will say injections. If you go to a doctor and they recommend cream, they have no experience with it.
How soon might someone notice changes after starting HRT or hormone optimization?
2 minutes. There's this weird misconception that it takes months or weeks to feel it. But no, the drug enters your system in minutes. So will you feel more in a month or in 2 months? Yes. And some changes take time to accumulate. But the drug is active in your system essentially immediately. So you inject the testosterone, and unless you're really not sensitive to feeling things, some people aren't. Some people, you give them a drug and they don't even realize they took it. But if you're someone who is aware of their body, you do that injection, a few minutes later, you'll be like, oh, I got a little more energy. But as time goes on, it will add up. Like you'll start to, you'll probably end up with a little more muscle mass even if you don't do anything. You'll feel better. Joints will be more lubricated. All the things I mentioned. Just everything in your body will just work better. And at first, you'll notice it. But over time, you'll actually forget about it. And then if you stop, they'll be like, wow, I forgot. Like, I felt really good when I was doing this. It's only now that I stopped that I see what it really feels like to be normal.
Well, that leads us on to the next question. Is HRD something people need to continue forever?
No, that is a big misconception. There's this idea, and it's especially purported in like the fitness space for why. I'm not going to try to theorize on, but they tell people that it's a lifelong decision. Once you go on, you can't come off. If you do things right, you can come off and your natural production will be better than when you started. That's my experience. I got a lot of experience with this. I can say that with confidence.
How often should someone on HRT or hormone optimization check in with their doctor?
So in the beginning, very frequently. Like I said, I have an extensive blood work list. When I work with people, you can't work with me unless you do that extensive blood work list. You got to do other health checks. Then you can begin. Then we do it like a month in. Then we do it at the end. And then, depending on how things go. Like some people, everything's good after a month. Nothing needs to be changed. But some people, you got to keep tweaking things for months. But once you've got everything set and it's working well, probably only once a year. I mean, maybe even once every 2 years, because once it's set and going well, now it just comes back to how often would you generally go to the doctor for your general health.
Well, you mentioned tests. What tests are done before someone starts?
Every organ system.
Mm-hmm.
So my blood work list is a paid list. I don't give it out for free, but yeah, test every single organ system. You want to use the best tests because there's a lot of tests that you go to your general doctor, they'll give them to you, and they're not very accurate. They're the standard. They're considered reliable, but they're not, especially if you're an athletic person.
Mm-hmm.
Like if you're just the average person who sits on their couch all day and is unhealthy, those tests might be good enough for you. But the thing is, if you're a very athletic, active person, you're not the norm.
How do you monitor hormone levels during HRT and
blood work?
That's it.
But you don't treat numbers, you treat people. So it doesn't really matter what the number is, it matters how the person's doing. If the number's low, but the person feels great, everything's going well, their body's functioning well, all their other blood work is good, why would you bring it up? If the number's really high, but the person's feeling well, everything's going well, all their blood work's good, their body's healthy, why would you bring it down?
Can HRT relieve symptoms like hot flashes or fatigue for our viewers?
Yeah, so that's with women. Definitely. The reason they have the hot flashes is they don't have estrogen. You block estrogen in a man and he'll get hot flashes. Yeah, it's not fun, and your brain doesn't work good. You get depressed. It's funny. People don't realize the importance of estrogen, like with men also. So, it's super important for women, but if a man doesn't have enough estrogen, he'll be depressed, he'll have zero motivation, his penis won't work, he'll have zero sex drive, he'll have hot flashes.
Didn't know that.
Yeah, he'll get well, if he still has good androgen levels like testosterone, he won't get osteoporosis. But a woman doesn't have so much testosterone, so if she doesn't have estrogen, she will get osteoporosis.
Are there lifestyle tips you can recommend to make HRT or hormone optimization more effective?
So number one, maybe it's worth it to try to optimize your hormones without medications, without taking injections. I work with a lot of people and do that as well. Like if you're young, there's a good chance you can get things going well without medications. But after a certain
Like
age,
what? Exercise,
proper diet, proper sunlight, mental also. People underestimate the power of the mind. An example I like to use, you're in the jungle and you see a tiger. That tiger didn't touch you. That tiger didn't harm you. Nothing physically changed in your body, but all of a sudden you have adrenaline pumping through all your veins and arteries.
Mm-hmm.
Your heart's beating fast, but there was no physical interaction with you. It's just your mind realized there's a tiger.
Danger.
For example, related to the hormone optimization, I've noticed with boys, when they move out from their parents' home, their testosterone levels go up considerably.
Why is that?
Probably when you're living with your parents, you're, in a lower position, you're not in charge of your own life so much. I mean, it's not a very masculine environment, typically.
Mm-hmm.
Perhaps when you get a girlfriend, your levels might go up. If a man goes to prison, his levels might go up.
How does HRT impact bone health over time?
Keeps them healthy. You don't have enough testosterone or estrogen, your bone health deteriorates. With women, it's mostly the estrogen. With men, it's the testosterone. Estrogen plays a lesser role in men for bone health because the testosterone, can do a lot of the work. Yeah, you don't have proper hormone levels, your bones are going to deteriorate, and your muscles. Everything just deteriorates. Your skin deteriorates, everything. Your teeth, it is important for teeth. If you optimize your hormones, you might notice that some of your teeth pain goes away, like the tooth sensitivity when you eat sugar. Yeah.
What's the connection between HRT and heart health?
What the medical community would like you to believe is for men, because we always got to separate men and women, that it's going to ruin your heart health. Oh yes, testosterone raises cholesterol, which is, of course, going to ruin your heart health. Now, if doctors are a little more knowledgeable, they'll go, well, studies show that, now this is, what a shocker. If you have low testosterone, it's bad for your heart health. If you have high testosterone, it's bad. You got to be in the healthy range. Like, what a shocker. When you're in a healthy range, you're healthy. But the reality is that there's very little evidence that taking excessive testosterone in moderation, like not gigantic bodybuilder dosages, that if you want to optimize your testosterone levels and you get it higher than is considered healthy, there's not much evidence that it's bad for your heart, because there's not a lot of evidence that high cholesterol levels are bad for your heart. And that is the main thing that testosterone is going to do that could theoretically impair heart health. For a woman, not having estrogen, all of a sudden you're predisposed to heart disease just like a man, because that's why they don't get heart disease when they're younger.
Does HRT cause weight gain, or is that a myth?
So it will cause weight gain, not fat gain, because if you go on HRT, you're going to have more healthy water. As you get older and your hormone levels go down, you desiccate. So I don't know the exact numbers, but when you're born as a baby, maybe you're 75, maybe 80% water, I'm not sure exactly. And as you get older, it drops, and when you're old, you can be down to like 55% water.
Is that why people really old look dehydrated?
Yeah. Yeah, so you get on testosterone, human growth hormone, some other hormones, and you'll plumping back up, and it's in a good way. Now, if you're young and you still got plenty of water, and now you increase your water a lot, you're going to look kind of fat.
Yeah.
If you ever look at a bodybuilder, their body is shredded, but their face is big.
Yeah, that's true.
But if you're old, it's good. It makes you look better.
Can HRT interact with other medications people might be taking?
What I'm going to say is controversial because, all medications in theory can interact with each other, but for the most part, no. It's going to do what it does, and maybe you have a pre-existing health condition that doesn't agree with what it does, but in terms of a direct interaction with your medications, no. These are natural hormones that are in the body.
Yeah.
That's like saying, is the medication going to interact with the hormones you already have?
Got, yeah. Are there natural remedies that work well alongside HRT?
Yeah. Healthy diet goes a long way. If you do HRT or hormone optimization therapy, but you're eating garbage, you're not exercising, you're not necessarily going to be healthy. This isn't a magic bullet that just makes you healthy no matter what. So yeah,
it's like taking that what's it called, that weight drug?
Ozempic.
No,
Yeah.
Ozempic, instead of actually exercising and stop eating shit.
Yeah, so if you're exercising and eating well, maybe you got good blood pressure, for example, but you start not exercising, not eating well, and all of a sudden you got high blood pressure. It doesn't matter that you're on hormones or not. Oh, something I want to touch on, and I actually had one client, something actually, I'm not going to get into, but he blamed the hormone optimization therapy for his fat gain. The problem some guys have is that they imagine that when they go on these medications, they can eat whatever they want. Now, I tell them, no, you can't. It will raise your metabolism a little bit. You can eat more. You can't eat that much more. It doesn't mean you can start eating a whole thing of Haagen-Dazs before bed. You still got to keep on top of your diet if you don't want to get fatter. So yeah, it's not some magic thing that you can just eat everything you want. But kind of related to that, but in the other direction, is when you diet down, you will hold on to lean body mass, aka muscle, a lot better. If you're natural and you diet down, it's not that you're going to lose all your muscle, but you'll shrink down a certain amount. You're on hormone optimization and you diet down, you're going to keep pretty much all your muscle.
What should someone do if they experience HRT side effects?
It depends on what the side effect is. Every side effect is different thing you got to do to fix it.
Okay.
You know, if it's catastrophic, you might need immediate medication to fix it, but in the long run, discontinue the hormone optimization therapy, or the smart decision, just modify it. But if you're working with an expert, it's never going to get to that point in the first place.
Can HRT improve sleep for those struggling with insomnia?
That's what I hear. That's not something I've witnessed a lot.
How does
actually, in the beginning, when you first start it, because it does give you more energy, a lot of guys can't sleep.
No, the opposite.
But it will pass. Maybe it will take weeks, maybe it will take a month, and that sounds horrible, and that's not the best. So that's something you got to take into consideration. Maybe
start a hobby at the same time. Well, you can
yeah, be extra productive, use the time wisely, or take some sleep medications, but you don't want to get hooked on those.
Yeah. How does HRT affect sexual health or libido?
If done properly, it improves it. But you can also do it improperly, and all of a sudden you have zero libido, or your sexual organs will not function. You can have high libido without functional sexual organs. You can have low libido with sexual organs functioning. You can have everything in between. But if you do it right, they're gonna both function better.
We did cover this before. How does HRT differ for men compared to women?
So women, that's going to be mostly estrogen, progesterone, human growth hormone. Men, you're going to be focusing more on androgens like testosterone, maybe some nandrolone, maybe some drostanolone or some primobolan with some human growth hormone. Every person's different. You got to custom tailor it to the person, not only because they react differently, but because they're looking to get something different out of it.
Is long-term HRT or hormone optimization safe for most people?
Yeah, in fact, it's healthy. What's not safe is staying natural. It's funny, I had some classmates a few years ago. They go, Andrew, you take all these medications and supplements. It's going to ruin your health. And I go, naturally you get old, fall apart, and die. Like, that's not what I'm interested in. I don't want to just fall apart, each year get a little bit worse, a little bit worse. If I can offset that, I'm going to do everything I can to offset it. So staying natural as you get older, that's the dangerous thing.
What happens if someone decides to stop HRT?
Depends on how you stop it. You stop it right, everything's good. I mean, of course, you're going to have the consequences of not being on HRT. Like I explained, you're going to fall apart faster, which is not good. You're going to die sooner. Who knows how much sooner you'd actually die, but you're going to deteriorate, and your quality of life is going to be a lot worse. But in terms of like direct side effects because of the discontinuation, like something bad immediately happening, if you do things properly, no. Your natural hormone production, if you're a man, will come back. If you're a woman, that's not going to come back, because once you're menopausal, you don't have hormone production.
I did hear with the COVID shot that some women reverse their menopause. Is that correct?
I don't know.
Okay. Are there age limits for starting HRT or
No.
hormone?
It just depends on if you're healthy enough. If you dig yourself into a deep enough hole health-wise, you're not healthy enough to even do it. It will keep you healthy for a very long time. It will keep your quality of life up. But if you're unhealthy enough, you can't even begin it.
Can HRT, excuse me, or hormone optimization therapy boost mental clarity or mood for our audience members?
Definitely, if it's done right. But if you overdo it or you do it wrong or you underdo it, bottom line is if you do it wrong, it's going to mess up your brain. And there's a lot of ways you can do it wrong. Now, a type of hormone optimization therapy, an alternative to, say, injecting testosterone and other androgenic hormones for men, some men like to use what are called selective estrogen receptor modulators, like tamoxifen, clomiphene, N-clomiphene. The big one now is N-clomiphene, which is better than the alternatives. The issue with these medications is most of them are mixed agonist-antagonists for the estrogen receptors. Estrogen receptors are present everywhere in your brain, in your bones, in your heart, your blood vessels, your nerves. The N-clomiphene is more so an estrogen antagonist, but that's still a problem. You don't necessarily want to... So, in case you don't know what an agonist or an antagonist is, it's something that mimics the function of a certain molecule, a drug, a hormone, or it prevents the action of that molecule, that drug, that hormone. And like we explained, you need estrogen. Your bone health will go down the toilet without it. Actually, everything. Your nerves, your brain, your blood vessels. So a lot of young guys now are trying to boost their testosterone levels by taking these SERMs that block estrogen. And it's not good. You don't want to block estrogen. The number one side effect that's immediately apparent, but most guys actually don't notice it until it's too late, is their mental health. If you are extremely mentally healthy and you take something like clomiphene, you'll be okay. But if you've even got a little bit of mental health issues and you take clomiphene, you'll think you're okay. You'll be laying on the couch crying and just thinking your life is horrible and everything makes sense. That's why you're on the couch crying, until you stop it and a couple months later you're like, that was really strange. Why was I on the couch crying? And I tell guys this. And sadly, there's a pattern. And ahead of time, I tell them this pattern. You're going to think you're okay until you stop it, and then you're going to realize you weren't okay. And a lot of guys get really depressed, and they think it all makes sense. Like, oh, yeah, it's for all these reasons, like it's from my girlfriend or it's from my job. But then they stop, and they go back to normal, and they're like, what just happened? And I'm like, see, I told you.
Lastly, on this subject, is there anything I missed asking you tonight on HRT or hormone optimization?
What kind of person should do it? So it's not about age. It's about, if you have somehow the most amazing hormone levels, you're young, nothing's happened to you, great, stay natural. But regardless of your age, if you need more out of your body, out of life, hormone optimization therapy is for you. It's not for the person who wants to do less. That's a mistake some guys make, is they think, oh, I'm just going to, do this injection and now I can just sit around, eat my chips, watch TV, and I'll be in good shape. No. It's for the guy that's already active, who wants to be more active, who's, his body's aching, he just doesn't have the same energy he used to have. He really likes life. He likes being active, but he wants to do more.
We we had a previous show earlier this year on stem cell therapy. Which would you suggest the best? I know they're completely different, but do you think people should do stem cell therapy first?
If you have an injury, perhaps stem cell therapy first. If you have a specific illness that stem cell therapy is known to help with, stem cell therapy. But if it's a general health thing, that's tricky. I would say hormone optimization therapy.
Okay.
Now, stem cell therapy, it's more expensive. It seems like, if it costs so much, maybe it's going to help me more. But for general health, probably hormone optimization therapy.
Okay, cool. Okay, so that's all the questions I've got. Do you want to tell everybody what you've been doing?
Yeah, I did 2 bodybuilding competitions.
While you're doing that, I'll get the photos. Is that all right?
Yeah, that's why I sent them.
Yeah. Well, you start chatting and I'll grab the photos.
So as Dave knows, recently I did 2 bodybuilding competitions. First one in Smolensk, Russia. Got 2nd place. There's a photo somewhere with me in the medal. And then I did one in Mogilev, Belarus. Got last place. Not embarrassed to say that. The fact is, I do a lot of different things in life. My life is not all centered around being a professional bodybuilder. And I didn't come in as lean as the other guys. Now, that's actually due to the fact that I got injured a year and a half ago, 2 years ago, pretty badly. Not nearly as bad as other times in my life, but it kind of re-injured some older injuries. And I took a whole year off of working out. Let myself gain a lot of weight. So despite dieting down for 6 months, I wasn't quite stage bodybuilding lean enough. But I think I still looked pretty good. That's in Smolensk, Russia.
And where's your little certificate thing?
Well, this is powerlifting. I got to pick this up around that same time. I actually won this, or sort of qualified for it back in December, I think. But yeah, at that same time as those bodybuilding competitions, I got my Russian Master of Sport certification. I mean, if you're an American, you don't really know what this is, but although it doesn't feel like a big deal for me because I've been working out so long and I'm pretty strong, it's actually a big deal. A lot of people, no matter how hard they try, can never get this in life. But if you're a top athlete, you know, all the top athletes have it.
All right.
But yeah, someday my medical office, I won't just be Dr. Andrew Hutchings. I'll be Dr. Andrew Hutchings, Master of Sport. I want to put that on the door if I work at a hospital in Belarus. And then people walk by and usually it's like their other medical degree, but mine will be Master of Sport.
Cool. Okay, anything else you want to cover while you're here?
I mean, we can just casually talk about bodybuilding, and I can say
go for it.
It's pretty interesting because, you know, how people look in photos, it's not how they look in person. For example, in Mogilev, you can't see him in the photo, but there were 7 of us. I think only 5 are visible in the photo. Yeah, that photo that's up right now, you can't see much definition, not bad, but you know, lighting is everything. But there was this one guy who looked really not good, but somehow after he got the tan on and with the lights on stage, and I looked at the photo, I'm like, wow, he actually did deserve to beat me. Like backstage, I deserve to beat him. But, you know, I'm an honest person. When I saw the photo, I'm like, you know, on stage with the tan and the lighting.
Here's the question, the tan thing, is that just to bring out the...
For me, it always makes things worse. I look way better before the tan, and I get the tan and I can't see anything.
Is it? Do you have to get the tan when you
do?
Oh, okay.
Unless you are as dark as an African, or maybe an Indian, or something, maybe a Mexican, I don't know. You got to get the tan.
Okay.
I was thinking maybe... Now, the tan also wreaked havoc on my skin. So the one in Russia was like water soluble. It washed off pretty easily. But the one in Belarus, it left like a sticky, rubbery layer on my skin that I actually had to like scrape off. Eventually, it wouldn't come off, so I got a sponge. You know, the rough side on the sponge? I loaded that up with soap and just scrubbed my whole body. I still got a little bit of brown paint on me. I got really bad acne all over the place. And actually, it's kind of forming like even some scar tissue. It's like, wow, that stuff is not healthy.
And is that supposed to define the areas? Is that what it's supposed to do?
I think it's because the lights are so strong. If you're white, just like everything, no detail.
Yeah, right, okay.
But in practice, whenever I get it, I look worse. But some guys look better, like that one guy. And another thing that's interesting, I'm not trying to bag on professional bodybuilders. You know, the average person, I think, doesn't think too highly of them. But have you seen or heard of like that roid gut or whatever people call it, like when they got the really big abdomen?
No.
It's like a turtle shell, but it's their abdomen. When I was in Russia, there was this one guy sitting down, and I look at his arms, and it's like, wow, that guy is shredded. And I look at his stomach, and it's like, wow, there's no way that guy's competing, but like he looks pretty shredded. I was confused, like, Why is he here? Like, is he someone's husband and he's just in his off season right now? Because his stomach was like out to here. And then he takes his shirt off to go for the spray tan. It's like, he's shredded. It's like a turtle shell. And a lot of these guys, they have, I don't know if it's actually an umbilical hernia or if it's just some weird side effect of being so shredded, such low body fat around your belly button. But they look like they have umbilical hernias. So they got these big distended abdomens with what seems to be an umbilical hernia. And they just don't look right. I never got that. I don't take so much stuff like they do. I'm not going to say what I do take, but I know what other guys take. And I think it's got to just be how much they're taking because, as I mentioned with the water retention, now you can do things to change the water retention. Like most bodybuilders, they try to come in really dry. But I'm thinking maybe they still have so much intra-abdominal water retention around their organs and the visceral fat that, even if they get super shredded, it's just distended.
What tips do you give to anybody who wants to start?
Professional bodybuilding?
Yeah. Well,
probably don't do it, or do it like me and just, be healthy, take a little bit of stuff. When I do it, I take some stuff just to prevent muscle deterioration while dieting down and to keep everything feeling good. Because if you're I don't look very thin, especially not in that one photo. I don't know if the audience can see it right. Yeah, I don't look very shredded there, but
that one.
Regardless of how shredded you are, if you are in a calorie deficit, or especially a strong calorie deficit long term, your health is going to suffer. Your hormonal health, your connective tissue health, your muscular health, everything. Because you're not giving your body what it needs to produce hormones, to heal tissues. So if you take a little bit of stuff, you can keep everything functioning well. If you did it naturally, your hormone levels would drop, so you administer exogenous hormones, and now you got healthy hormonal levels. Those hormones also keep your tendons and ligaments healing properly. Now, of course, if you really just didn't eat anything, no matter what hormones you have, things can't heal if they don't have the building blocks. But it's healthier to take a little bit of stuff and do a bodybuilding competition than all natural. I did one all natural. I actually looked better than when I didn't. Ironic. But it's not fun. It feels a lot better to do it with some supplements.
You suggest bodybuilding or doing powerlifting?
I suggest doing what you like to do. Just make sure you do it safe. Don't ruin your health.
Okay.
I just like working out. Side effect is you look cool and you can do a bodybuilding competition. It's
where did you go to do that?
Smolensk and then Mogilev. So Smolensk is Russia, Mogilev is Belarus. Smolensk is nice. I was surprised because I heard it's a garbage dump over there. Trying to avoid bad words. But it was nice. They're not as clean as Belarus, but it was a nice place. Pretty funny, though, the shared Belarus-Russia Visa Act.
Yeah.
I just hopped on a train and went there. I didn't know anyone that's done this, so it was a little bit risky, like, how's it going to turn out? But it turns out you just hop on the train, and you hop off the train, and you're in Russia. But you don't have a stamp in your passport. And I booked a hotel, like, kind of on the outskirts of the city, because they were all booked for some reason. I thought, who's going to Smolensk on vacation? I don't need to book the hotel ahead of time. But because it was like the first warm weekend of the year, or like the weather was just warming up, every single hotel was booked. I'm talking, I checked like 50 hotels. Eventually I found one.
Is it a big city?
Bigger than Minsk.
Oh, is it?
Yeah. I don't know if it's technically bigger than Minsk, but like the main part of it is bigger than the main part of Minsk. But yeah, I get to the hotel, and show my Belarusian permanent residency, and the woman's like, what is this? Like, do you have a passport? So I show her my passport. She's looking for the stamp. And I'm like, oh, there's no stamp. I came on the Belarus-Russia Shared Visa Act. For anyone who doesn't know, I speak Russian pretty well. I got a thick accent, but it's understandable. So she said she had heard about that, but she was kind of suspicious. Like, she kept looking for that stamp. And she's like, when did you come here?
Especially with a U.S. passport.
Yeah.
Yeah.
And I'm like, 20, 30 minutes ago. And she's like, what do you mean? I'm like, hopped off the train 20, 30 minutes ago. And she's like, okay. And then she starts to ask me a bunch of questions like, why are you here? Where do you live in Belarus? What's your occupation? Some other questions. And I thought that's all. But probably I started around 11. I started drinking vodka and eating carbs because you want to fill up your muscles with carbs for a bodybuilding competition, and you want to urinate out excess fluid. Should have just taken a little diuretic pill or done nothing. It's not fun to be hungover the next day because I drank the vodka with minimal water. So it's like purposely giving yourself a hangover. But so I'm drinking my vodka, eating my junk food to get the carbs in me, and I'm shaving. So I'll like shave an arm or two, and then I'll go back, relax a bit, drink some more vodka, eat some more chips or cookies or whatever. And I'm in the corner of the room. I should have brought my computer to watch something. It's pretty boring to stare at a wall and drink vodka and eat junk food. Like, some people might think that sounds good, but it's pretty boring. And occasionally, like, I got this little table. Actually, I think it was a little table that I put all the stuff on. So it was cramped, and occasionally, like, I'd knock my water bottle off it or something, make a little noise. I don't know if it's because of that, but I get a knock on the door. So it's 1:30 in the morning, and I'm naked because I'm shaving my whole body. So, like, I open the door and put my head out, and it's the front desk lady and the security guard. And the security guard goes, "Are you smoking in there? The fire alarm's going off." And I'm kind of drunk, and that's also really strange. Like, there's no such thing as a silent fire alarm, and I don't hear anything. Like, that would defeat the purpose of a fire alarm. So I'm like, what? I'm shaving. I mean, that's what I was doing. And the security guard, "Oh, yeah, that's probably why. Have a good night."
Strange.
Yeah, I'm pretty sure shaving doesn't set off silent fire alarms.
No.
But yeah, they came to the door and they looked kind of worried.
Oh, really?
I mean, if I was doing something bad, do they think I'm going to invite them in and be like, "Hey, come look what I'm preparing to do bad in here"?
Yeah. Come and look at my spy stuff.
Yeah.
Yeah, exactly.
A funny experience. Bodybuilding competition was nice. They had a little concert afterwards. Band there, play some currently popular Russian music.
Many people in the competition?
Hard to say how many. Enough. Not the biggest competition.
Different age groups, I suppose.
Oh yeah, all different ages. Like the one in Belarus and Mogilev, there was a guy that was like 60.
Mm-hmm.
You got like teenagers up to 60-year-olds. Yeah, it's an interesting experience. I don't know if I'll do it again. Number one, because of the tan. The first thing I was thinking is, I got to at least wear a mask next time, because they're spraying this stuff on you, and it's going into your nose. Like, I don't know how much makes it all the way to my lungs, but I blew my nose afterwards, and it wasn't even brown, or it's actually a little bit red in person. It was just black. It was so concentrated that when I blew my nose, it was just all black on the napkin. And I can feel it a little bit in my lungs. So at that point, I'm thinking, I really don't want to do this again. And then, like, the next week when my skin's all getting acne and messed up, I'm thinking, man, like, it's fun to do those competitions, but is it worth it? And who knows? Is that stuff going to cause skin cancer? What's in it? I don't know.
Well, as we know now, it looks like suntan lotion does.
Yeah, I mean, everything you put on, well, not everything, but you put stuff all over your skin. That's a lot of surface area to absorb whatever's in it.
Yeah. Okay. Anything else you would like to talk about?
Anything interesting going on?
In the world, just the same usual thing. Same thing in Gaza, Ukraine, Middle East.
Oh, something interesting world-wise is, typically I view conservatives in America as being a little bit better than the liberals, but they're usually the freedom of speech people. Have you noticed that they stopped being freedom of speech people? All of a sudden you say stuff they don't like about Israel, you say something good about the Gaza people, Palestine or whoever, and now you're getting deported or not getting your university degree.
Yep, or being censored.
Yeah, it's very ironic coming from the people that are like freedom of speech even when you don't agree with it.
Yeah, well, it's always on different subjects, isn't it?
Yeah.
Yeah, unfortunately. Okay, well, that's a wrap for live show 135, Hormone Replacement Therapy. We talk HRT. Huge thanks to our resident medical expert,
If you're
Andrew.
interested in doing hormone optimization therapy, contact me. Like I said, you can only work with me if you do all the required health checks.
Yeah, and his links are in the description below. Anyway, thanks, Andrew, for breaking down everything on HRT with us tonight, straight from the other side studio in Minsk, Belarus. We hope leaving with you with answers and insights to empower your health journey. And there he's flexing. I won't do that. I won't do that. It looks pathetic.
Well, you got a jacket on. They can't see any.
Yeah, well, yeah, okay. Underneath. Don't forget to check out Andrew's links in the description box below for more resources. If you love this episode, share the video links, smash the thumbs up, and subscribe to our channels on Rumble, YouTube, and X for more live shows. And drop your questions in the comments below, and we'll keep the conversation going. Until then, next time, stay curious, take care, and thank you again.
Thanks for having me on.
Yeah, anytime. Bye-bye, everybody.